Welcome back to Meet the Penis. This is our 6th episode, and today I have with me Jay Shakuri from St. Louis, correct? Michigan. And then we also have John Beasley from Columbia, South Carolina. And the question of the week was a question that was addressed to us because apparently there's been some quote-unquote negative press on different approaches, which would include our approach, which is the infrapubic. And today it's interesting because we have well-trained urologists who are experienced in both, and today we're, learning the infrapubic technique the way that we do it here. So, Jay, first, you're a resident. You're getting out and going to go into private practice in West Virginia, correct? So, tell them about your previous experience and maybe a little bit about your experience today when it comes to the approach.
So my training has essentially involved the scrotal approach for the past 5 years, and when I saw Dr. Perito's approach with infrapubic, wanted to learn about it more, and today we had the experience to participate in this approach, and it seems to be very advantageous in many respects. It has a smaller incision, it has less manipulation of the scrotal tissue, and I think it's going to definitely be something I'm going to be trying to employ in my practice.
Thanks, that's great. John?
So my training was in penoscrotal also, but once I started private practice, and I've been in practice for 24 years now, have used the infrapubic approach, but definitely felt I could hone my skills coming down here and working with Dr. Perito's technique. A lot of things Jay was saying I would agree with fully. Love the small incision, love the approach, love the placement of the reservoir, just so many things about it that make it nice. Like the fact that you're staying out of the scrotal area a good bit. I know a lot of patients when I was in training came back very uncomfortable after that scrotal approach, and this is really nice, just a very small incision, very easy access, and just a really nice overall result.
I did not pay them for their opinions. But I will tell you, when it comes to the infrapubic approach, penoscrotal approach, subcoronal approach, in all honesty, a year down the road, done well, they're all the same outcome, which is a great outcome, 95% patient satisfaction, and patients love it a year down the road. The biggest advantages to the infrapubic approach, which, John, I think you really summed it up nicely, is that you don't have an incision on your scrotum. The incision on the scrotum is an obstacle to rehabilitation. It takes you a lot longer to get back into a normal sex life. The rehabilitative period can be far more difficult, and it's just more uncomfortable. We talked about it last night that our waiting rooms are a nice place to be with this infrapubic approach. The tiny incision that's only as big as the pump above the penis allows us to not cut your penis, not cut your scrotum, and get the entire case done through that tiny little incision that has 4 staples in it at the end. You may see things saying that certain approaches make a penis longer. The penis is only as long as God gives it to us, and we have had several other episodes talking about penile length, and we'll go back over those again, I'm sure, because there'll be another question down the road. But when you are doing your research, make sure that you find guys like these two to do your implants, because you want somebody that's experienced and is dedicated to the craft of a penile prosthetic. So once again, welcome back to Meet the Penis, and we'll see you next week. Bye.